Health Watch is presented by UMass Memorial Healthcare. Here, caring for you.
Welcome to Health Watch, presented by UMass Memorial Healthcare. I'm Brittany Schaefer. Today I'm joined by Dr. Balakrishnan, and we're here today to talk about the measles. So my first question for you, doctor, is what are the measles exactly, and what does it do to the body?
The worst part about measles is it's a very highly contagious viral illness. With measles, what usually happens is you start with a fever. We could have high-grade fever, runny nose, conjunctivitis. People develop some complex spots, which are like some rash in the mouth, and they develop a rash which starts from the head to the toe, which are some red colored rash, a flat rash. Now the period that you're contagious is 4 days before the rash and 4 days after the development of the rash. The symptoms might usually start a week or two after you're exposed to someone who had measles.
How do measles vaccines work?
The measles vaccine, it's a live attenuated, which means it's a weaker measles virus in there. So when you get the vaccine, you have a milder form of infection, and the body responds to it by producing immunity, which is basically producing the antibodies. And that stays in your body, and that's how the vaccines work.
How are the vaccines of today different than years past, say the 1960s?
So 1960s was the time when the vaccines actually was manufactured and came out. In the period of 1963 to 1967, there was two types of vaccines. The one, the live attenuated that we have now, and the other one was the killed virus vaccine. And it has been shown that the people who got the killed virus vaccines did not get that much immunity, and that's the way it was different. So if you have a documentation saying that you got the killed virus vaccine, you should go ahead and get the live attenuated vaccine now.
Does the vaccine wear over time as one gets older?
So 99% of the time, the vaccine gives you lifelong immunity. After the first dose of vaccine, it's effective 93%, and after the second dose is 97%. So if, say, after the first dose you did not get enough immunity, the second dose produces enough antibodies. And as I said, 99% you get the immunity that you need. There have been some, like around 3 out of 100 people who received both the vaccines but did not have enough of the antibodies. But that's again very rare. How do you know you have adequately vaccinated? So one way to know is if you need to have a written documentation, one of receiving 2 doses of the vaccine, and you are a school-going child, or you are an adult who is at low risk. A low risk meaning that you're not a health care professional, or you are not a high school student, and you're not internationally traveling. But say if you are a preschool child and you're an adult at low risk, you should have received at least 1 dose of vaccine. The other way you know is you have a laboratory evidence saying that you are immune, which is again testing for the antibodies in your blood. Or you have a laboratory evidence saying that you had the disease, which again, when you had the disease, they have done testing done. Or you were born before 1957, because at that time, most of the people had the measles infection and they got immunity through that.
What is the typical vaccination schedule for kids?
So CDC, the routine recommendation is for the child to have the first dose and on or after your first birthday. It could be given between 12 to 15 months, and the second dose in the range when you are 4 to 6 years old, so before you go to school. And for the adult, you need to have at least 1 dose of the MMR vaccine. And again, if you're not a high risk professional, if you are at high risk, then you need to have 2 doses, at least 28 days apart.
Why are we hearing about measles now?
There are a lot of people who are unvaccinated, and the other thing that's come out is as the people who are vaccinated between the years 62 to 67 got the killed viruses in the vaccine, so they have low immunity. So since it's still prevalent, it's not endemic here, but you still are getting exposed to people who are not vaccinated, and then they are getting the measles infection.